I really want to talk about postnatal depression because it is such an underestimated problem. It's quite common. About 15% of women will have a degree of postnatal depression, if not more. And I see it an awful lot in my surgery. And I tend to see it when it's already been there for some weeks. And by that point, mum is really miserable, really down and depressed, feeling guilty that she feels like that. The baby has picked up on her depression. The man in the family isn't very happy either. He thinks that she's ignoring him because she's gone off him. So there are all sorts of family dynamics going on, all because of something which is so common. And it's not just down to hormones. You know, anyone who's just had a baby is really tired, physically and mentally anyway. Their sleep is being disturbed. They feel that they should be the happiest person in the world. Everyone keeps telling them that, and they don't understand why they don't have the energy to feel that way. It's not their fault. It just happens. Now, the good news is that you can remedy this, but it might take as long to get better again as it did to get way down there in the first place. So the first step is to recognize the symptoms. Are you feeling very tired mentally and physically all the time? Have you lost all interest in the pastimes and the hobbies that you used to enjoy doing? You know, is your appetite different? Are you eating more or eating less? Are you tearful? Are you crying about the least little thing and not understanding why? Are you having arguments? Are you irritable, looking at your baby thinking, I don't recognize this baby as mine, I'm not looking after my baby very well, feeling guilty? Are you feeling in despair and not seeing any joy in the world or even in the future? Because all of these things are very common in postnatal depression. And what I want you to understand is if you feel like any of those things, then you're not alone. So many hundreds and thousands of women have felt like that, and it will get better. I want you to go and see your doctor, tell your partner how you feel or somebody close to you, so you can share those feelings. Because if they understand it's not them, but it's the way you feel, you can get help. Go along together to a sympathetic healthcare professional. And if you don't get that sympathy first time with Dr. A or Nurse B, go and see somebody who does understand postnatal depression. They will look after you, they will get you better. And a combination of antidepressants plus some cognitive behavioural therapy, talking therapy, counselling if you like, will get you right. But do it today.